Looks like folks are starting to trickle in here at a pretty good clip. Well, it's 7:01 right now. We'll get going, or 7:02. Let's call it 7:04. We'll kick this off properly. But before then, I'll tell you what, who's ready to get back to being able to have these things in person? It's great to have like the flexibility and we can plug in and get off and get on. But man, I'll tell you what, I'm looking forward to that day.
Joey, can you hear me?
Yes, I absolutely can.
It's Margie. I may or may not stay for the entire thing. We're having some major Wi-Fi issues and I might end up leaving, but we have been invited to go back to the post. They are open to 25% because things are at phase 2. So that's just something we can look into later,
Okay.
but I may have to leave because I'm just using data now. So.
Okay.
Thank you.
Margie.
Sorry.
Yeah. Okay. All right, well, welcome everybody to our February quarterly. For those of you joining for the first time, welcome. It's great to have you here and participating. For those of you coming back, it's great to see you again and appreciate the continued engagement and support for our community. We do have 7 o'clock till 9 o'clock blocked out. That's the expectation. We're going to do our best to keep it within that window. But we do have a great set of items to discuss and a number of different folks that are going to be participating. So it should be a good evening for all of us to be able to learn a little bit and appreciate all the effort and the work that's going on within the community. My name is Joey Dunn. I am the president of the West Hill Community Association. And like I said, we're going to do our best to keep this within 7 to 9. But thank you for everybody jumping in and participating here tonight. The first housekeeping item that I do want to talk about, and I'm going to kick it over to Finn here in just a minute, is that we are accepting applications for our board of WHCA, and that election will be happening here in a couple of months. With that, I'm going to turn it over to Finn to fill you in on a little bit more of those details. And then once she wraps up, we're going to jump right into our agenda. So with that, welcome. Thank you. We got a couple hours together. Let's make the most of it. So with that, Finn, I'd love to turn it over to you to share a little bit more about our elections coming up.
Thank you, Joey. Good evening, everyone. I'm Finn Hardy. I am the vice president of the board here, and we are eagerly looking for new board applicants. So the application is open on our website. You can visit mywesthill.org/board and /again. You just need to be 18 years old or older, love the West Hill, and be interested in helping to shape some of the events and partnerships. So we are always looking to grow and make sure that we're really reflective of the community. So we encourage all folks to apply. And if you'd like to learn a little bit more about what it's like to be on this all volunteer board, you are welcome to reach out to us. Feel free to check out this website. There's an email address for more information, and we'd love to get to know you. Those elections, as Joey mentioned, will be happening at our next quarterly meeting in April. So you have until then to decide if you'd like to apply, and we will be filling 5 positions. We turn over about half the board every year, and a board term is 2 years. The other thing that I just wanted to mention is we've also opened up our 2021 sponsorship program. So if you have an organization or business and would like to sponsor, become a sponsor for West Hill, there are different levels starting at $150. You can check out our website, mywesthill.org/sponsor/, and we'd love to partner with you. So with that, I'll turn it back over to Joey to get the agenda started. Thank you.
Thanks, Finn. Yeah, as Finn mentioned, it is an all-volunteer board. I would strongly encourage everybody that's interested to use, I'll at least put myself out there as a point of reference, that if anybody's interested in learning more before they put in their application, or if anybody would want to have any questions answered, I'm more than available to have those conversations. But there's a lot of incredible work that's being done, and you know, if it's something that you're interested in, I would strongly encourage you to put your name in the hat and see what happens. Okay, so with that, we're going to jump into our community reports. We have 3, 6, 7 different items that we're going to go through. We have about 40 to 45 minutes blocked off here, so I would ask everybody to be respectful of time and try and keep it into the guided 3 to 5 minutes apiece. If it goes well beyond that, I'm going to do my best to keep us on track, but hopefully we all do our part here and keep this thing moving effectively. So with that, I'm going to turn it over to Maggie from Reach to talk about Center of Hope. And I apologize, I can't see everybody that's on the line just because of the way the Zoom works, but Maggie, if you're out there, I'd love to turn it over to you. Okay.
Joey, I think it might be Reverend Bianca Davis Lovelace will speak for Reach. So Reverend Bianca, are you there? I see she's on the call.
Yes, I'm the executive director of Reach.
Great.
Thank you. Okay.
No problem. Yep. No problem at all. So I wasn't planning on speaking, but let's see. As far as with the Center of Hope, we are Reach is a 501c3 that's been in existence since 2013. And we have 2 programs. One is the Center of Hope, which is our shelter for families who are experiencing homelessness. And then we have also a community meal program. But the center of this conversation will be the Center of Hope, which is our family shelter. And we take in women and children, mostly women and children. We do take in some fathers, but majority of the time is women and children. And we will be partnering and building a shelter along with Lake Ridge in the Skyway area. So we will be coming into that particular neighborhood soon, which is literally down the street. We're not that far from you all currently in Renton, but we will be in that area. Yeah, and we are hoping to eventually open around possibly April, and we really want to get to know the community, really want to engage the community. We are very social justice focused, especially, myself as the ED. I've experienced homelessness as a child. I've, been working in the community as an activist in the Seattle area for a while, and working with those who are poor and marginalized is a passion of mine, and it is a focus that is within Reach organization. And so we've just been, pushing forward during 2020, during 2020, entering into 2021 with COVID-19. We were at a crossroads where we weren't sure exactly where we would land as far as with our shelter. But by the grace of God, we have been blessed with funding to that will allow us now to house our residents 24 hours a day, 7 days a week, without worrying about whether or not we will have a permanent shelter. So we are just very blessed and very happy that we have women and children and families overall off the streets, especially during COVID-19.
Great. Thank you for that. And I apologize for putting you on the spot there. But well done. I appreciate the time and the words tonight.
No problem at all. No problem.
Great. Okay. Well, thank you. So next up, we do have Skyway Coalition, Jeremy Williams, and then followed by that will be Skyway Water and Sewer. This is a heads up. Go ahead, Jeremy. Welcome.
Thanks, Joey. Hey, everybody. Jeremy Williams, speaking on behalf of the Skyway Coalition. Just wanted to provide some quick updates for you about what we've had going on as of late. But first of all, I just want to say thank you to everybody who helped with the relief for families affected by the Green Tree apartment fire that happened right around Christmas time. Thank you to King County Fire District 20 for your response, and thank you everyone who brought in goods donations and also who donated to the Skyway Fund. With that fund, we were able to direct more than $150,000 to the families that were impacted by the fire. So it was a very immense and inspiring response. As far as stuff going on within the coalition, we've started working with a couple of grad students from the University of Washington Communications Program, Brooke Prieskorn and Jordan Zhang, who are helping us with our communication strategy. So if you could go and look up Skyway Coalition on Facebook, follow our new page, and we hope to start getting some content out through that soon. We'll also hopefully get our website redesigned with a lot more content about just the ongoings of the coalition and being a little bit more transparent about how exactly we're approaching partnership with community. Another thing is we are nearing the end of our hiring process for our new coalition manager position, and we hope to have an official announcement about that very soon. We've also been working with King County Equity Now to explore ways to work together with Skyway residents, landowners, business owners, et cetera, to advance Black-owned and Black-led community development projects in Skyway, and especially try to partner that with upcoming legislative agenda and funding from the state of Washington to make that come to fruition. And then last but not least, shout out to everybody who's been helping with, advocacy around and petitioning for having the U.S. Bank property donated. As everyone's aware, the U.S. Bank property, U.S. Bank has closed the Skyway branch, but that property is, I think, still in play for donation to, possibly become like a multi-service center for the Skyway community. So those conversations are ongoing, and we hope to hear a decision from U.S. Bank soon. And that is all that I have. Thank you.
Great. Thanks, Jeremy. Okay, so Skyway Water and Sewer. Cynthia, I see you there. I'll turn it over to you, and that'll be followed by King County Local Services. So John, Kevin, David, and Bob. But Cynthia, the floor is yours.
All right. Thanks, Joey. And please give me a 30-second warning if I use up my time or more than my time. So we're obviously responding to the COVID situation. Our front lobby is still closed. Our staff is working staggered shifts to stay safe. We're continuing to provide water and sewer service as we normally do. We're gearing up for a couple of capital projects to be put out this spring. That's based on approval from our Board of Commissioners. One in the north of Renton between 72nd and 76th, and 116th and 118th, large sewer main project. And then another down in the Bryn Mawr area between 82nd and 87th, and 117th and 120th to replace old and vulnerable water mains. We're continuing with no service disconnects or late fees until further notice. It's all dependent on when the emergency gets rescinded. So stay tuned for more news, and always check our website for current information. The other notice thing I'll just point out is that we our website services and automated phone system are down due to a potential breach by one of our third-party vendors in processing payments. So again, check our website. Current information is there, and I'll give up the floor.
You're well within the time. Forget about it.
I'll entertain questions then if anybody has any.
Yeah. Are there any questions for Cynthia?
All right, thank you.
There you go. Great. Thanks, Cynthia. So like I said, next up, there is some questions in the chat. I do want to call out that we have chat available. So make sure to be paying attention to your chat window as some side conversations are going to occur. Okay, so King County Local Services, John, Kevin, David, Bong. Not sure who is going to speak on behalf of folks. All right.
I will kick. Lots going on. We are in the process of working on a participatory budgeting advisory committee, creating one. The council gave the Department of Local Services $10 million in the budget process and reallocated a bunch of the marijuana revenue to a community-led budgeting process. So, you know, decisions to be made about how those dollars get spent by the community, decision-making by representatives from the community. We are sort of trying to figure out what we think that approach will look like. And we're going to be coming out to the community pretty soon. Councilmember Zahalai's office has been very involved. Those dollars are only for urban unincorporated King County. So we'll be probably coming back to this group in the future to talk more about that. So stay tuned. Other bit of news, we had a request for proposals out looking for a coordinator to help support our efforts around sub-area planning and participatory budgeting and some other stuff. And Urban Family won in that. So they're going to be in the process of figuring out how they're going to be bringing someone on board to do that work on behalf of the Department of Local Services. We are going to be kind of working on fleshing out our community needs lists. That's what that person is going to be working on, community needs lists. Again, if you'll think everyone probably has heard this spiel by now, but that is the enumeration of all the things in the community of Skyway that have been identified that need to be funded by King County or others. And it is part of the sub-area plan. Kevin Leclerc, who's on this call, has been working on that. Bong San Domingo has been working on it, as has Hugo Garcia. And we are just going to be looking for input on that community needs list, and we will be getting support from Urban Family and I'm sure from the West Hill Community Association and others as that work continues to move forward. And then finally, we're just, you know, continuing to be involved in the pop-ups every Friday to give away PPE, you know, hand sanitizer and masks until we are through this pandemic, which I think, you know, the good news is things are starting to look better in terms of the numbers around the pandemic. The bad news is there are not yet enough vaccines for everybody, and we still have work to do to get those out there, but I feel like we're making progress. And we continue to do work in the community, and Bong did some great work recently working with some residents on 67th Place and 128th Street, cleaning that up, getting the sheriff's office involved, King County Roads and others. And I'm going to just yield a little bit of my time to Hugo. Hugo, if you're on, I think Hugo just wanted to quickly touch on a couple of things. So that is my report, and I will turn it over to Hugo.
Thanks, John. Just wanted to share with folks, we ended the year strong with the small business grant distribution, and we're continuing to look for ways to support local small businesses. we'll be having a Small Business Alliance gathering. Oh, my apologies. My coworker here, I apologize. Preston, on March 1st at 2 in the afternoon, we'll be getting together and open to have conversations with the small business owners in Skyway to check in on them, find out if they have questions on ongoing phase 2 reopening updates, or hopefully phase 3 in the next 2 weeks, as well as getting information on other financial resources that may be available. Currently, SBA has ramped up and made improvements to make it easier to get PPP and EIDL funding. So we'll be setting up monthly check-in meetings with existing business owners and also checking in on new business owners. Restarted to send out welcome kits to business owners that have applied for business licenses in the area. Happy to share that there's some in Skyway that in the month of January applied for business licenses. So I've initiated to reach out to them so they're aware of DLS, our department, and how we can help them set up shop and do business in Skyway. That's all I had. Happy to stay on and answer any questions.
Great. Okay, thanks, John, and thanks, Hugo. There's no questions. We'll keep going. Excuse me. We have King County Fire District 20, Chief Hicks, and that'll be followed by King County Sheriff Office, Jimmy Mitchell, Deputy Jimmy Mitchell. So, Chief, I'll turn it over to you.
Thank you, Joey. All right. If it's okay, I'll take a minute of the water department's time since they didn't use it all. Thank you, Cynthia. I'm just going to start off quickly by reading a quick summary of the Green Tree Fire. You know, anytime there's a fire in the community, it really affects us all. And so I just want to give everybody kind of an up-to-date on what really happened that night. So on December 23rd at about 1:41 a.m., the first 911 call came into the dispatch center. The caller reported smoke and flames from the unit next to their apartment. Between the time the first fire engine was dispatched and on scene, several residents were calling in, and many of them could be heard by dispatch coughing and yelling. Prior to our fire engines arriving, 3 sheriff's deputies started evacuating the building. No doubt they saved lives that night. Our Skyway fire engine arrived on the scene and reported heavy smoke coming from the center unit of the C building and 1 person with injuries. The fire spread from the 2nd floor apartment into the stairwell and broke through a window on the east side of the building. Then the fire spread to an upper unit and then into the attic space. The fire spread laterally, threatening buildings on either side. The incident was upgraded to a 3rd alarm due to the demand on resources on the scene. We also requested a mobile command unit and a metro bus for warming residents. We received support from several fire agencies, including Renton, Tukwila, Berrien North Highline, the Kent Fire Department, Port of Seattle, King County Medic 1, Zone 3 Fire Explorers. Throughout the incident, the numbers kept changing. We didn't know if it was going to be 50 residents displaced, but it ended up being around 24 plus adults and 6 children. Several area nonprofits stepped up to help provide assistance to the residents. The Renton Regional Community Foundation, in partnership with the Renton School District, John Taylor from King County Department of Local Services, King County Council Member Ramai Zahilai, amazing help, you know, having him there on the scene and helping out with the residents. West Hill Community Association, Urban Family, Dare to Be, and the Skyway Coalition. You know, and forgive me if I missed anyone. There was so much help. Forgive me if I missed any organization that was there. The support from the community was nothing short of amazing. Our department played a support role in helping the nonprofits organize by offering our training room as a drop-off location for clothing and food donations. The support was overwhelming and completely filled our training room. And it also filled the community room of the Jesus Center Freedom Church. Monetary donations were collected by the nonprofits. I'm extremely proud of our Skyway firefighters. You know, if many of you don't know this, the majority of our department is made up of volunteer firefighters, and they were on scene that night. The entire incident was very challenging for our crews. They encountered access issues, a non-sprinklered structure, and freezing temperatures. I also want to recognize my admin staff, Leah Johnson, Agnes Goldingay, and our public information officer, Eric Autry. They provided information to residents and help with clothing and monetary donation coordination. Our phone was ringing off the hook for a good week and a half. So we had to kind of change up our messaging system on our phones because the phones were ringing off the hook. And for good reason, a lot of residents were in need. So that's just the fire part. Are there any questions about the Green Tree Fire that I can provide? Okay, no questions. I will talk just quickly about COVID-19. Public vaccinations continue to be a challenge for many in our community. I know personally many families who qualify for the vaccine but can't get an appointment due to supply and other logistical issues. I receive regular updates from King County Public Health, and I know the county and the state are working on securing more vaccines. Our department is in the process of setting up a mobile vaccination unit. There are other fire departments around us. You probably heard on the news that Seattle has started up a mobile vaccination unit. They've hit a lot of the assisted living homes in the city of Seattle, and we are gearing up to do the same in Skyway. We're hoping to form a partnership real soon to set up a mass vaccination site in our community. Any questions on COVID-19 for me? Okay, if not, don't forget you can follow us on Facebook, Instagram, and Twitter at Skyway Fire. Thank you.
Thanks, Chief. And I would encourage anybody to use the chat feature as well to follow up with any questions. Understanding it's a big group virtually, it's a little bit tough. So feel free to use the chat as well. Thank you, Chief. I'm going to turn it over to Deputy Jimmy Mitchell for King County Sheriff's Office.
All right, hello, West Hill. Okay, Joey, I'm gonna try to keep it under 5 minutes, but as soon as I hit 4 minutes, give me the old 1 finger mark. So we'll start out with just basically an overview of crime. I just got these stats hot off the press today, actually just a few hours before here. I know everyone's interested in what's going on in the community. So our statistics for January, as far as like major crime, which is your burglary, arson, robbery, high larceny, thefts of that nature, crimes against people, we had approximately 44. We're slightly up from the same time as last year, but not much. Last year in January 2020, we had 41. So slightly up, but still fairly flat. Other crimes which are like your simple assaults, your fraud, your vandalism, controlled substance violations, things of this nature. They were actually down from last year. In fact, the numbers were exactly inverse. We had 44 or 41 in January 2021 and 44 in January of 2020. So overall, as I was talking with some folks last week, things have been pretty quiet in West Hill as far as crime goes. We've kind of been in a steady state in the last few months, which is good, right? Obviously, no crime is better. But we haven't seen a drastic rise that we've seen in other parts of the country, other parts of King County. So that's been pretty good overall. I will say anecdotally, from a patrol standpoint, we have seen kind of an increase in dumping of stolen vehicles in and around West Hill. That doesn't mean they're being stolen from West Hill. They steal them in Seattle or other parts, and then they kind of dump them off here. So we're kind of put an emphasis out there. They've been dumping them over by the power lines across from the park and whatnot. So we're kind of concentrating on that. I want to talk about two major warrants that we had recently. On February 6th, our special emphasis team conducted a search warrant to seize a marijuana grow and an illegal marijuana grow operation in West Hill. They made 2 arrests out of it. 578 plants were seized. This grow operation of approximately 600 plants generates around $700,000 of illicit funds. Now, the sheriff's office is important to understand. we do not go after marijuana growers or anything of that nature. This whole investigation was a 2-year investigation that started from a 911 hang-up call in 2019. But we still investigate these and make the arrest because the illegal marijuana grows of this undermine our legitimate marijuana growers and distributors, of which we have several in the West Hill area. That $700,000 on the illegal fund diverts money from West Hill that goes to our drug rehabilitation and education and other funding because the taxes and whatnot. And Councilmember Grimay-Zahili has worked very hard to bring those marijuana tax funds back to West Hill. And without this type of enforcement, those funds are undermining the legitimate marijuana business and diverting needed funds to our community. And of course, none of these people who conduct these illegal marijuana grows actually live in our community. The owner and all the grow operators do not even live in West Hill. They simply bought the house, rented it out, and used it for their criminal acts. And also, these types of activities are a nexus for other criminal activity to include home invasion robberies and organized crime or whatnot. Next quickly I want to touch on, last week we had a drug seizure nearby Tukwila. This was actually fairly large seizure with 6.1 pounds of meth, 2.6 grams of heroin, 19 grams of cocaine, 14 fentanyl pills. You probably heard about that in the news. 3 handguns, which one of them was stolen, 4 rifles, 2 of them which were stolen. Now, it was right outside West Hill, which is why I bring that up. In fact, our detectives and our arrest team used the Skyway storefront to stage for that warrant seizure, but that type of activity still affects the greater community. And finally, I want to close with a thank you to the West Hill community, the West Hill Community Association, and everyone at large. This will be my last quarterly meeting. Panel to choose my replacement, made up of 4 great community members. Will be meeting on March 5th, and we will make that decision, and we will let you know soon as that person is selected. So thank you very much. Pending your questions, that's all I have.
All right. Thank you, Deputy. Appreciate your time and service. We'll miss you. We'll see you around, I guess. I do want to call out, there was 2 questions that were put in the chat just for the good of the group here, asked of Chief Hicks. One question from Facebook was regarding the Green Tree fire, what the cause was, and it was an unattended, cause of fire was unattended cooking. And then Chief, if I could ask you the question, there was another one put into the chat that was, what is happening next with the Green Tree apartment building that burned?
You want me to answer that over chat or just here?
Yeah. We have a couple minutes. If you wouldn't mind speaking to it.
Sure. So shortly after the investigation was done, the building is turned over to the owners, and the owners, they go through their process of getting permits and basically restoring the building so residents, they can start renting out units again. So it's really on the owners on where it sits. I've been by there a few times, and they are doing work. They're actively doing work on the building. So I would imagine that would be open, for rental here probably by this summer.
Yeah, I could jump in on that too, Chief. So I talked to Jeanette. She's the manager for Green Tree. The owners are going forward, just as the chief said. They estimate it's probably going to take about a year before it's back up and running. So, summer at the earliest, but most likely late fall, early winter before it's habitable again or being able to rent. That is typically what happened last time this happened a few years ago. That's all I got.
Thank you, sir.
Okay. All right. Thanks, folks. Thanks, Chief. Appreciate you letting me put you on the spot there. Okay, so that's the end of the community reports that we had scheduled. Was there anything else that we have a couple of minutes for that anybody would want to bring to the group here before we turn over to our main presentations? Okay. Great. Okay, so with that, we're going to run into our main presentations here. We have Renton School District, and then we have Public Health from Seattle and King County COVID vaccine. So up first, Renton School District from Randy Matheson, Executive Director, Community Relations. Randy, great to see you, and I'll turn it over to you.
Thank you. Thanks for giving me a few minutes to speak about what we're doing in the Renton School District. The biggest news that we have right now is beginning March 3rd, we're returning some students to school. So we're opening schools back up. Elementary schools is where we're going to focus. Preschool, kindergarten will be the first group of kids who are coming back to school, along with some special needs students, some students in what we call self-contained special education classes. So they're high needs special ed kids. So we'll start with that on March 3rd. And then in subsequent weeks, we'll start to open up for other grades and other groups of kids. March 16th will be first graders. And then every week or so after that will be another grade leading up to kindergarten through fifth grade at elementary schools. So that's March, April timeline. And we've been doing a lot of work preparing schools to get ready for students and staff to come back. In late January, we queried our parents to ask them if they would rather come back to school or whether they would like to remain with in-home learning. About 99% of our roughly 7,600 families in those categories actually responded to the survey. So we had an immense survey response by our parents. About 53% said that they want to remain with in-home learning. So we are going to continue providing in-home learning with qualified teachers and continuing with Zoom classes and so on. And about 47% or so actually said that they would like to return to school. And so we started putting in place all the parameters to make schools safe, right? So we started our custodians are learning new ways to clean up schools between students who show up for class in the AM and then switch out to the PM. Our school bus drivers are learning to clean buses as students are going to be provided transportation. So there's cleaning in between groups of students. We're following all the CDC and health department guidelines. Small cohorts or small groups of students, 15 or less in each grade level or in each classroom. They stay together for the time that they're at school, which is about 2.5 hours a day. And then they leave, that's the AM group, and then there's a PM group that comes in as well. So what we're doing is moving the 2.5 hours of live Zoom class into the school for students who want to come back to school, families who want their students to come back to school. We'll move through this process cautiously, always watching healthcare or health department numbers at any time. Obviously, if there's a spike in numbers, we would have to reevaluate what we're doing and figure out whether or not we shut this down and move back into a full in-home learning or whether we have a hybrid sort of model. But right now, as was mentioned earlier in the evening, numbers are starting to decline. For school districts, our numbers are quite large. So 350 cases per 100,000 residents is where we can actually start to move kids back into school. And right now I think the last time I looked, we're at under 240. So it's a good opportunity to move students back to school. We're well within the CDC and health department guidelines. We've worked with our staff to ask staff about their health needs. Do they have health issues that would preclude them from coming back into the class? Do they have family members that they live with that they are concerned about and that would preclude them from coming back into school? And so we've got our numbers set now with our teachers and students to actually start this process to bring students back to school. So that's all of our elementary schools. Middle and high schools right now, we're still working on that plan. That's a lot different than elementary school because middle and high school kids move from classroom to classroom, whereas elementary students come into a classroom and they're in that classroom most of the day. They go out for PE or music or those kinds of things, but for the most part, they stay within a group of students in a classroom. So middle and high schools are a little bit more difficult to manage, but we're working on a plan and we hope to figure something out soon and share that with our community and our families. That's the biggest thing that's going on right now. I do want to mention that the schools here on the West Hill, Dimmitt Middle School is doing some wonderful work to reach out to their students, keep them engaged. You can imagine middle school students not being in school and you know, spending a lot of time on Zoom can shut down quickly. And Dimmitt Middle School is doing a wonderful job engaging those kids, celebrating their achievements, going out to home visits with sort of awards to celebrate student achievements and attendance and those kinds of things. Our elementary schools on the West Hill are doing phenomenal work. The teachers are doing great work engaging families and students. We have obviously a lot of different cultures and languages on the West Hill, and our staff are really working hard to make sure that families remain engaged regardless of their family situation. And then of course, Renton High School is still doing a bang-up job with their International Baccalaureate program, engaging students, keeping students attending school, and doing really good work to just maintain their work through this school year. There's some seniors, as you can imagine, there's seniors who are worried about graduation requirements and what happens at the end of the school year, and you know, going to college and so on. So there's a lot of that work that continues even though we're not in physically in schools yet. So students are doing, our staff are doing wonderful work to engage our students and families. So I think that's the biggest piece, the fact that we're opening schools now. Again, March 3rd is our target date for elementary schools. And we hope by the end of April, we're in kindergarten through 5th grade in those schools. Again, offering all families an opportunity to remain within home learning if they choose to, and return to school if that's what they'd like to do. So.
Oh, great. Okay, thanks, Randy. There's a couple of questions that are coming in from Facebook here. I can read them out for you if you'd be able to address them. The first one is, are you ensuring that teachers are vaccinated prior to March 3rd?
No, vaccination for our staff is not a prerequisite for opening schools. It's not a prerequisite anywhere in the health guidelines right now. We'd love to have our teachers and our staff vaccinated, but right now the trajectory of vaccinations being available just pushes it out too far. And so we can't guarantee that staff are going to be vaccinated. We are working, however, with Valley Medical Center and other health organizations to try to put together vaccine sort of opportunities for our staff when the vaccinations are available. That doesn't mean our staff are going to jump the gun or jump the line. It does mean that they still have to fall in line based on healthcare guidance. But we are working with Valley Med to try to figure out if we could have large-scale vaccination opportunities when the vaccines are available, and as our staff move forward in the line to be vaccinated.
Okay. Okay, thanks for the clarity there. Next one was, is Campbell Hill Elementary opening to in-person, and do they need any support or donations?
That's wonderful. We always appreciate the community's willingness to jump forward and do these kind of things. Right now, no. And in fact, what we're going to be doing in schools, so yes, Campbell Hill is opening. And two, no, right now, we don't need any additional support. In fact, our work is going to be to try to limit the number of adults and people in schools. The fewer people we have in schools, the less there's an opportunity for our staff and students to become, COVID positive from outside sources. So we really need to make sure that our schools are just tight working operations with not a lot of visitation. In fact, even families who come to school to drop their kids off are going to be stopped at the door and just allow children to come in. So we really need to monitor who's in the building and make sure that there's no opportunity for widespread COVID activity. So.
And when those kids are being dropped off, I would imagine it's a temperature check and some other guidelines or protocol, correct?
Absolutely. So we're going to have parents actually doing what we call health screenings, attestations every morning, saying that their child doesn't have certain sort of guidelines for COVID. The temperature is at a certain level, no symptoms of COVID, and temperature checks every morning. And then, of course, staff are going to be monitoring students. If they show signs of illness, they'll be moved to a side, probably in the health room, and parents will be asked to come pick them up. So we'll be monitoring students even before they come in the door and then through the time that they're in school.
Okay. Thank you, Randy. Is there any follow-up questions for Randy?
So our entire plan is on our website, rentonschools.us. It's the first thing you see when you pop onto our website. Lots of good information, a lot of FAQs, frequently asked questions for families and community. And my information is there. You can always reach out to me specifically and I'll answer any question you have. So.
Terrific. Okay, thanks, Randy. If there's any follow-up questions, again, please feel free to throw them in the chat and we'll redirect them over to Randy time accordingly, or Randy, feel free to answer them directly in the chat.
I'll do it. Thanks.
All right. Up next, we have from Public Health, Giselle Zapata Garcia with Seattle and King County COVID vaccines as the talk here. So Giselle, I'll turn it over to you.
Thank you, Joey. And I actually have some slides that I wanted to share. Should I share them or were you guys going to share?
Yeah, Giselle, you should be able to go ahead and share.
Yeah? Okay. All right, perfect. Can you guys see this?
Yes.
Yeah? Okay. All right. Thank you again. My name is Giselle Zapata Garcia, and I am joined here with my colleague, Gina Hernandez, who's also with Public Health, and we co-lead the Latinx Community Response Team under Public Health's Seattle and King County's Community Mitigation and Recovery Branch. So we're really happy to join you guys today and give you a quick little update here. So we're going to go through very quickly where we're at in King County, the vaccination phases, the sites, resources, and some time for questions as well. So we don't want to get into the weeds too much, but we wanted to make sure that you guys had access to our data dashboards. We've got several different options to look at, but this one allows you to see that we're really actually doing well. These three green circles versus the red diamond or triangle, I'm sorry, shows you that we're on track. So the chart, the little line graphs to the right, the one that's red shows you that we're coming down closer to the red dotted line. So we are doing a great job in King County in really reducing the number of cases of COVID, but we do still have some work to do. So we don't want to let our guard down. It's really important to keep in mind. In the county, we have some numbers that we're able to update on our website as well. And so when you look at this, these are the number of cases per 100,000 within the county broken up into different areas. So as you can see, the largest number would be down in Auburn, Kent, and Federal Way. We have Burien, Renton, Tukwila, and SeaTac. It moves north from there. Excuse me. So, so definitely there's a lot of cases in the south end of the county. So one thing to keep in mind is that we actually in the county receive the distribution of vaccinations from the state, from Washington Department of Health. And so at this time for the county, as of the 16th, we had been able to provide 275,000 doses for the very first dose. And then for those who are receiving the second dose, 107,584. We're going to go through a little bit more about eligibility for who can receive the vaccine right now. But just keep in mind that we're going to go over some of the high volume vaccination sites. And there's a team in public health that's actually working on pop-ups as well as mobile vaccination teams. And I heard the fire district representative talk about the partnership that looks like is also happening currently behind the scenes. So there will be more to come, but please keep in mind that we can only vaccinate as many people as we're receiving vaccines for. So we appreciate everybody's patience in hanging in there with us as we continue to receive more vaccines to vaccinate as many people as possible that are eligible. So right now for the county, broken down again by different parts of the county, as you can see, the focus has been the aging population. So we've got higher rates of percentages of vaccination. And for those who are 16 and older, but younger than 65, a little bit lower. And that is because we have prioritized the aging population at this time because they are at higher risk. So basically what you want to keep in mind is that right now, again, the numbers are looking so much better each day. They keep going down. So that really makes us very happy to see that, but that doesn't mean we should let our guard down. It's going to be really important to maintain all of the practices that we have been really encouraging and recommending, not just at the county level, but at the state level as well as the federal level. So making sure that you are staying indoors as much as possible, wearing your masks, increase ventilation, stay 6 feet apart when you do have to go out. And then if you do have any signs or symptoms, to make sure that you get tested. The one thing that has come of a lot of this data that we've gathered is that the most common place to get exposed is within your own household, as well as non-healthcare workplaces, healthcare settings, and community and social gatherings. So another reason we gotta make sure to not let our guards down so that those numbers don't spike again. And as I mentioned, the supply of the vaccine is still limited. We are hopeful that we will continue to receive more, but there are vaccines available through our health department, as well as healthcare providers and pharmacies throughout the county. And then all adults over age 65 are currently eligible, along with healthcare workers, first responders, nursing home residents, and others at high risk that we will go over here in just a minute. So currently who we have eligible would be those in phase 1A, which are those healthcare workers, as well as staff and residents living and working in a long-term care facility, and then home health and care aides. And then for phase 1B1, which again we are in, would be those that are age 65 years and older, or if they are 50 and older, they do have to live in a household where there are at least 2 or more generations living together, and that they meet one of these items. Either the individuals that are over age 50 cannot live independently and receive support from a relative or caregiver, regardless of whether they're paid, or even from somebody who works outside the home. Or they live with and care for a young child, like a grandparent or a grandchild. So all of these individuals are definitely eligible to receive the vaccine at this time. As you can see here, this is from the Department of Health. We're currently moving into this next section. At the top, you see where it says spring and summer. So we're hopeful that we will be able to move here very soon into the next phase, but please keep your eye out for the news and sign up for the notifications as well from the Department of Health and Public Health Seattle and King County to keep up to date on what the latest is. And so we currently have recently opened up 2 sites, one in Kent and one in Auburn. And it is the goal to expand vaccine access to the most vulnerable older adults in South King County, because as you saw, the percentage of the cases are much higher in South King County. And having these sites are helping us prepare for more access to become available as well. And again, we are at these 2 sites, we are providing vaccines for 65 and older, as well as the group of the 50 and older who cannot live independently and live in multi-generational households, as well as the caregiver, home care worker. And then please, again, keep in mind that there will be additional groups that can schedule appointments at these sites as vaccine supply increases. So to be able to get scheduled, you do have to go either to our website and you can schedule an appointment there, or you can do that by phone. Interpreters are available. And so you would call the 1-800 number that's here on the screen and press the pound sign, and somebody would be able to assist you. And then currently both vaccine supply and appointments are limited, so there may be some delays due to the high volume of inquiries. Just a reminder, because I know we have heard that it is a concern, and we are aware of that and working on it and doing the best that we can at this time. So things to keep in mind when you go to your appointment. So you want to try to take photo ID with your date of birth. At the sites that we are coordinating, you will not be turned away if you don't have ID. If you have health insurance, it is helpful if you bring a copy of your insurance card, but it's not required. And then we do recommend wearing short sleeve shirts or clothing with sleeves that can be rolled up to make it easier to administer the vaccine. And we had some common questions that we figured we would share here. So, well, are we charging? Absolutely not. Just remember that if you do have insurance, we are appreciative if you can provide your insurance card. The insurance would cover it, but we do not charge at all if you have no insurance. There should be no copays, no deductibles, no out-of-pocket period, even if you have insurance. And if there are any issues around that, we would appreciate you letting us know. Folks who are undocumented are more than welcome to get vaccinated as well. And then the Auburn site is actually drive-through, and then the Kent site is a walk-up location. It does have ADA accessible. It's the ShoWare Center, so the parking lot is right there across the street. And then we do have interpreters available at all of our sites. Now, if you're not able to go to one of our sites, there are plenty of other places that you can go to, including your own doctor's office if your doctor's receiving vaccine, or another healthcare provider. There's a lot of the federally qualified health centers, so the community health clinics like HealthPoint and CMAR that are receiving vaccines. I do understand that they go very quickly, but they are at the very minimum receiving them regularly, so it doesn't hurt to check as well with their websites that have the scheduling available. And then the Washington State Department of Health has the findyourphasewa.org that you can go to confirm your eligibility and then get connected to the list of all of the locations, including pharmacies at grocery stores and that kind of thing that have vaccine available. Again, if you're not able to access the internet, you're welcome to call this phone number here on the screen during those hours, and they do have access to interpreters as well. We would like to make sure to share a few resources. If you do know anybody who is uninsured, there is a special enrollment period for health insurance from February 15th through May 15th. For those who are low income enough, you can actually be possibly eligible for Medicaid, Apple Health, any time of the year. So do make sure to please share this number out for CHAP, Community Health Access Program. We have several staff members that speak many languages that can assist with the whole application process, as well as eligibility, all the way through making sure that you get your health coverage that you're eligible for. In addition to that, the staff can also help with ORCA Lift cards, as well as the subsidized annual card that just recently came out. And then the breast, cervical, and colon health program, access to baby and child dentistry, which is known as ABCD, even basic food and utility assistance program. So it's a great number to keep on hand and share with community to make sure that they have a place that they can call and speak to somebody in your language and receive all the assistance navigating our complex healthcare system. I'd like to invite you guys also, for those who are interested on receiving more regular updates and an opportunity to ask questions. We do have bi-weekly monthly community partners calls that are from 4 to 4:45 on a Monday. And here's the Zoom link, and it would be every other week that those calls occur. For the Spanish-speaking community, we would appreciate that you please share that we have also calls for the community that speaks Spanish every Tuesday from 5 to 6:30, where they can receive all of the latest updates, have an opportunity to ask us directly any questions or share feedback, and just troubleshoot any issues that come up. And those are done through Zoom as well as Facebook Live. And then we do have our website that has a lot of information on the vaccine, as well as other COVID-related resources and information, including our isolation and quarantine sites. So we really want to invite you to check out our websites, as well as all of the information in all the different languages. I think that's it. Thank you for having us.
Yeah, thank you for the information. There was a couple of questions that were put in the chat. Before we go into those, is anybody on the line that would want to ask the question directly? Okay. So one of the questions that came through was from Finn. What will determine when we move into the next phase of vaccination?
That's a great question. And that's actually determined by the Washington State Department of Health and the governor. So they have not yet shared, well, there's two parts. There's the phase of what's allowed to be opened up. So that part hasn't been shared, but the diagram of the phases that I showed you on the actual slide, that one is definitely showing that we should, somewhere in between spring and summer, be moving on to the next actual phase of vaccination. But it will be determined on how many vaccines we are receiving. So that is determined though by the state.
Okay, thank you for that. The next question was, Mayor Durkin noted that she wanted Seattle to be the first city to reach 70% of the population vaccinated. Does the county have any such goals?
I have not heard that at this time. Gina, have you? No? No. Yeah.
I haven't, no.
Okay. Okay. Thank you. And then the last question that was put in the chat was, is the King County vaccination site's website a central appointment portal, or does it provide a list of sites which then would need to be contacted individually for appointments?
So the King County vaccination sites link that was provided in the presentation is for Auburn and Kent only. And then the State Department of Health has a webpage with you select your county basically, and then it'll give you a whole list of all of the places you can go to within the county, and each of them has either their own link or their own phone number to reach out to.
Okay. Great. Well, those are the questions that were put in the chat. Is there any other questions before we move on? But thank you so much for the information tonight. It's very helpful.
Thank you for having us.
Okay. Okay. So moving on to the last item on our agenda is from Maha. We have the King County Metro. So with that, I'm going to turn it over to you. Where are you? There you are. The floor is yours.
Great, thank you. Good evening, everyone. My name is Maha Jashan with King County Metro, and I'm also joined by my colleagues Nicole Aguirre and Melissa Allen, and we will be sharing with you a little bit about what Metro and Skyway projects are going to be like. If you remember, I don't remember if it was a quarterly meeting or one of the monthly meetings. I had come and had a quick overview conversations with folks and just shared about where King County Metro is at and how we want to partner with Skyway and co-create with community. If you can go next, Nicole, to the next slide. So as a reminder, for the 2021-2022 budget fund, there was budget allocated to expand on Metro programs in Skyway. So we, some of these programs we've heard from community before through our work with DLS, through various reports before this, that we heard that the community wants Orca youth cards, flexible services, community van, mobility transit hub, and transit infrastructure improvements. And what our hope is that we want to come in and start talking to community, give an overview of what these programs are, and have community help us decide where the funding should be allocated for and what is the type of programming that community wants, and then deciding on how to do that. And so today we're kicking off this rodeo show, so to speak. This is our first time having a formal meeting, and what we're hoping to do today is I'll turn it over to Nicole and Melissa. We'll give an overview about what flexible services is, what that work is, and then from there we'll talk about next steps and how you can plug in with all of us. And our hope is that we will come back at the next quarterly meeting and share the next programs with you all and so forth. So with that, I'll turn it over to Nicole and we'll get started.
Thanks, Maha. Hi, everyone. My name is Nicole Aguirre, and I am a service planner at King County Metro. And my colleague Melissa Allen and I are here today to talk to you about two different flexible services for Skyway. So like the name would imply, flexible services can be really adaptive, and what they look like, how they operate can vary greatly based on the needs of the community that they're trying to serve. So in Skyway, the needs, in Skyway, the needs that we've heard so far that we're trying to respond to include increased access to Link Light Rail and Renton Transit Center, increased access to schools and shopping destinations, offering a suite of mobility options, because as we all know, transit is not a one size fits all, and people in the Skyway West Hill community deserve to have options, and expanding Via to Transit, which is the first program that we're going to talk to you about. So for those of you who might be unfamiliar with Via to Transit, Via is an app-based service that connects people within a specific geographic location to rides that take them to a transit center where they can then access frequent or high capacity transit. You're able to book an on-demand ride, either on the app or on the phone. It's kind of like Uber. They might ask you to walk a little bit. The typical wait time is about 10 to 15 minutes. They come pick you up and then they take you to a transit hub. Since Via to Transit is a Metro product, we do strive to put equity first in a number of ways. We do offer a ADA accessible option, which is called Wave. For people who don't have smartphones and aren't able to access an app, we do have a call center that offers interpretation services. And Via to Transit's payment method is linked directly to our Orca regional card. So people are able to use reduced fare programs if they qualify on Via rides. As you can tell, Via to Transit is not something that is typical in a service area. So one of the big hurdles to getting people to understand what Via is, know that it's available for them, is education and outreach. And so this is something that we try to do through a diversity of language, through ethnic media ads, reaching out to contacts at community-based organizations so that they can spread the word about the service that's available to people in their communities. So right now, there are currently 3 different service areas that have Via to Transit service in South King County. There is the Othello service area, the Rainier Beach service area, and the Tukwila service area. You can see at the top, the main difference between these 2 service areas is the hours and days that they operate. And what we're thinking, based on what we've heard so far, and this is what we would really like to get your feedback on, is a Via to transit service in Skyway would probably be an extension of the Rainier Beach service area. So it would look something like this. So you can see the purple area up at the top is the current Othello Station service area. And the darker shaded area to the south would be an extension of the Rainier Beach service area to cover the Skyway West Hill service area with 2 transit hubs, one at the Rainier Beach Link Light Rail Station and then one at Renton Transit Center. What we've heard from the community and what we're proposing is that we would like to provide span that is equivalent to Link Light Rail, so all day, all week, from early morning to late at night. And all these different things, the service area, the hours of operations, the number of hubs, and whether we want point-to-point access, meaning less walking. These are all things that we can adjust. This is just sort of our early concept based on what we've heard. But all these different parameters that we can adjust do have different trade-offs in terms of cost, efficiency, and wait time. So that is all that I have for Via to Transit right now. So I will pass the mic off to Melissa Allen to talk about Community Van.
Thanks, Nicole. Hi, everybody. Good evening. So a little bit different than Via to Transit, we also have Community Van as a potential offer for the community. And what this is a pre-scheduled reservation-based service where any member of the community can connect with a community transportation coordinator and make a reservation to travel anywhere within the Skyway community or anywhere within the greater King County area. So pre-COVID, a lot of uses for Community Van were specific events and things that are happening in the city, hearings. Folks have used it to attend memorial services. We've had, I think, a trip to the Tulips. We've had local agencies and organizations utilize it to help transport youth or seniors to augment different programs that are available through communities in the agency. We also have, in addition to those one-off trips, we do regular recurring trips to local resources, such as grocery store trips. We have food bank trips in almost every existing community that offers Community Van right now. We also can do recurring trips to libraries, anywhere in the community really that the community provides feedback and that there is a need for. Metro provides the vehicles, fueling, and maintenance. And the drivers for Community Van are members of the community. So again, anybody in the community can apply to become a driver. There is a set of criteria that they need to be able to meet in order to become an approved driver. There's a small orientation process that they go through. And with that, they work with the transportation coordinator to fill trips or to also request use of the vehicle. And with this service, just like Nicole mentioned for the previous service Via to Transit, we are interested in offering equity. We do have accessible vehicles. We also have an interpretation line and can certainly meet the various needs of the residents in the community in order to hopefully fulfill their transportation needs. And Nicole, if you'd go to the next slide, please. So just a couple of highlights about this service. Volunteer drivers always ride free, which is fantastic. There's no cost for that. And we do monitor our drivers regularly. We do monthly motor vehicle report monitoring. So we are ensuring that our drivers remain approved and meeting all of the criteria for the safety of anybody using the service. It is a standard Metro fare to ride Community Van. We do accept the ORCA cards. We do also accept Transit Go mobile ticketing and social service tickets. And you can transfer to other services. So again, if there was a connection to a transit hub or again to another service in the area, that will work within the 2-hour window. We have currently several communities offering Community Van. Our first community was Duval. We are also in partnership with Department of Local Services, which will be the case for Skyway as well, in partnership on Vashon Island. We are in Bothell and Woodinville, Kenmore, North Kirkland, Shoreline, Lake Forest Park, and Sammamish. And this year we are very excited. We're in the middle of launching with Algona and Pacific right now, and Skyway is next on our agenda. So we're very excited to start focusing more on the community of Skyway. And then later this year, we are planned for Tukwila and Redmond. And that wraps up the very high level overview of the community van service as well as Via de Transit. Casey Gifford is the program manager for Via de Transit. Nicole is our project manager for this particular community. And I am also available for questions related to community van. So our information is there. And certainly feel free to reach out to any of us with any questions or thoughts that you have after this. And we're very excited to hear what the community has to say. And that is it for Nicole and myself and Maha.
Thank you. Before we start with the Q&A, I just wanted to say next steps really quick, what community can expect from us. We will be sending up a follow-up email with a survey, and also we will be hosting some type of open house virtual session where we can talk more in depth and start talking about these options. But right now, we would love to open the floor up if you have questions for Melissa or Nicole, want to learn more about these programs.
I will also say, particularly with the Via de Transit service area that we have proposed, that is kind of a lot to take in the short time that we have here. So we can also send out those slides, which will have our contact information.
I see that Cynthia raised her hand. Please go ahead.
I did, yeah. Maha, how will you reach out to the community? What means will you use to get feedback from the community in addition to forums like this?
That's an excellent question. Thank you so much. So the way we are thinking about doing this is 3 different buckets. One is using online, so translating the materials, pushing it out on social media, using ethnic media channels and such. The second one is really focusing on the different forums and already plugging into the groups that already exist, whether it's the Skyway Coalition, whether it's this group and others, where there's trust built with the communities. The third one is also partnering with Councilmember Zahalai's office and DLS and the different events that they have to push that out that way. So those are the methods and means we're trying to do. In addition to that as well, we want to reach out to all the various CBOs individually, so all the community-based organizations, and offer them one-on-one sessions and make sure that they have the information as well.
We've offered this opportunity to other ventures that King County has put on. We do a bi-monthly newsletter, and you're welcome to provide content to put into that. So you should have my email address, and or you can use our info at Skyway WS to contact us, and we can give you the schedule for the newsletters.
That is wonderful and would be amazing. Thank you so much.
Mm-hmm.
Terrific. Is there any other questions for Maha, Nicole, or Melissa? But it sounds like we should also expect to receive, potentially the information that you just displayed. Terrific. That'll be helpful. Okay.
For sure. Should we go ahead and send that to Jeannie or Jeremy or yourself who to send out to folks?
Jeannie would be great. Yeah.
Yeah, you can go ahead and send it to me, and I will make sure that it gets to our communication to be sent out in a more public way.
Appreciate it. All right. Thank you.
Thank you, Maha.
Okay. Thank you, Maha, Melissa, and Nicole. Appreciate that and looking forward to the continued dialogue. Okay. So with that, that does bring us to the end of our agenda. If there's anything else anybody wants to mention anything, please feel free to use that time right now. But if not, I do want to call, I do want to take note of everybody that took time to present information tonight. There's a lot of different moving parts. I love being a part of these quarterlies because you really see how many different initiatives are in flight and how the community is coming together. It's very inspiring. There's a lot of work being done on from the WHCA to continue these initiatives and support in a lot of, in as many ways as possible. But yeah, it's always, it's one of those things where, I see Deputy Jimmy, who's now on his last time here on this quarterly, right? And I think we're fortunate to have had great people come through here, be a part of it. And I look forward to our next quarterly. We, of course, have our board meetings coming up for WHCA. We have one, in fact, it's going to be, I want to say it's going to be next week, I believe. And then, of course, we have elections coming up in April. So a lot of good things happening. Appreciate everybody's time here this evening. With that, I'll draw this meeting to a close, but please feel free to follow up with any other information that you might, care to share or discuss. So thank you all.
Thank you.
Thanks, Joey. Everyone have a good evening.
Thank you all.
Bye,
everybody. Take care.
Gracias. Thank you, everybody.
And just FYI, you can find all of the links to the websites for all of the speakers tonight in the Facebook chat. Thank you, Lynn McKay, for documenting those.
And live tweeted on Twitter, and it will be soon on our blog on mywestville.org.
Thanks, Devin.
Thanks, Jeremy. You ran this thing.
Great meeting, everybody.